Hello, my name is Jennifer Ottowitz, and I'm a rehabilitation teacher at the Badger Association of the Blind and Visually Impaired. I work with adults who are losing or have lost their vision. This video covers vision impairment and blindness. My colleague, Jerry Niedermeyer, will also be joining us to share tips later on. In your work as a CNA, you will most likely come in contact with people who are blind or visually impaired. You may or may not be able to recognize that they have a vision impairment. But the information and tips covered in this video will help when assisting all patients or clients, especially those with vision impairments. Vision loss alone does not affect a person's ability to hear, their intelligence, their ability to walk, or their need for self-esteem and independence. People who have recently lost their vision may have difficulty at first adjusting to the many changes in their lives caused by the vision loss. They may need more assistance at first, especially if they do not know about adaptive aids or skills yet to help them remain independent. People who have lived with their vision loss for some time may already know about these skills and adapted aids. Always ask the person if they need your help and how they would like you to help before doing things for them. Remember, you must treat your patients or clients who have a vision loss or who are blind with the same respect and dignity as you do all your patients or clients. Having a vision impairment means having difficulty seeing to read, recognize faces, view things far away, or seeing only part of the environment, even with your glasses on. There are several myths about blindness and visual impairment. Myth: people with vision impairment or blindness see nothing at all. Actually, only about 10 to 15% of people with loss or who are legally blind see nothing. Most see some light, color, forms, or movement. Myth: people can correct their vision just by wearing glasses. Glasses cannot correct all vision impairments. The need for glasses depends on the extent and cause of the vision loss, as well as other factors. Myth: nothing can be done to assist those with visual impairment and blindness. With proper training, adapted aids, information, and support, people with vision impairment or blindness can develop good self-esteem and increase their independence. In most cases, they can learn to live on their own, raise families, work, and be a part of the community. Myth: all eye conditions get worse. Some eye conditions do get worse, but this may happen slowly over time. Some remain stable, and some change from day to day. With proper care and treatment, many eye conditions do not lead to total blindness. Myth: all eye conditions can be corrected with surgery. Although surgery does help some eye conditions, many cannot be totally fixed with surgery. Surgery is often done to prevent vision from getting worse instead of making it better. There are several common signs that may indicate a person has a vision loss. These include squinting, knocking objects over when reaching, overreaching for objects, sweeping with their hands to locate objects, probing in front of them with one foot when walking, bumping into objects when walking, placing and moving their arms in front of them when walking, and always looking down when walking. Some common eye conditions you may come across in patients or clients with vision impairment include age-related macular degeneration. This is often considered an age-related eye condition. For example, it is associated with individuals age 55 and older. It affects central vision, which makes reading and recognizing people's faces difficult. It does not lead to total blindness because side vision remains. Color vision may also be affected. Diabetic retinopathy can occur in people who have diabetes. Vision impairment occurs when abnormal blood vessels leak into the back of the eye, known as the retina. This is associated, as I said, with long-term diabetes. If left untreated, it can lead to total blindness. It often makes reading, shaving, or threading a needle and other daily activities and near tasks difficult. With cataracts, as we grow older, the lens of our eye gets cloudier. Often, vision becomes hazy. The treatment is often to remove the cloudy lens and replace it with a clear lens. With glaucoma, the inside of the eye has very high pressure. If left untreated, it could lead to total blindness. It affects side vision and usually progresses very slowly. When working with people who are blind or visually impaired, there are several tips which you may find helpful. Identify yourself when entering the room. Ask before offering assistance. Don't assume that help is needed. Do not touch the person without identifying yourself first. Describe what you are doing or why you are there. If objects in the room have been moved, put them back where you found them, or tell the person where they are now located. When giving directions, don't point or say things like, over there. Use real terms the person can relate to. For example, to the left of the door, or 3 feet in front of you. Do not shout or speak loudly unless you know the person also has a hearing loss. Feel free to say words like look, watch, or see. They are part of our everyday language. Let the person know whenever you leave the room. And act naturally